And welcome back. Well, type 2 diabetes is a chronic condition that can be tough to manage, but our next guest has found a way to put a positive spin on that diagnosis. This book is called Dr. Enno's A to Z Guide to Thriving with Type 2 Diabetes, and it's based on years of clinical experience. Dr. Enno is a physician, popular speaker, life coach, and author, and she's here with a powerful and positive message for people who are living with Type 2 diabetes. So nice to have you here.
Thank you for having me.
I love it. I think this is fascinating. So your background is widespread, and you are trained in functional medicine, correct?
Yes, I'm currently trained in functional medicine.
What does that mean for people who aren't familiar with that? What does that mean, and how has that brought you to helping people?
Well, actually, my journey as a primary care physician, I've been a physician for over 22 years now, and I always had a question as to what more could we do for our patients to get them engaged. And diabetes actually was a kind of roundabout way to introduce me to functional medicine, because I was really very interested in not just the diagnosis, but really looking at the root cause and helping people to get engaged in their healthcare.
Yeah.
And so functional medicine really goes into the root cause together with the patient, and is a kind of individualized, personalized method of medicine where we kind of map out how to allow people to thrive despite chronic illness, one of which is type 2 diabetes.
Well, and that's, I think, going to shock people to hear you can thrive with type 2 diabetes, because a lot of people living out there don't feel that way. And that's what was happening with a lot of your patients, is you were counseling them, saying things over and over to them, which led you to writing this book. What is the book about? Because it's in this A to Z format.
Yes. Yes. So many years ago when I was in private practice, I, would tell a patient, hey, I just got your blood test back and you have diabetes, and they'd go that instant, oh my God, I'm going to have an amputation, end up on dialysis, have a heart attack. And I was like, wow, you're just going from 0 to 100. And I began to get my patients engaged. It actually became a challenge to me to defy that myth, because a lot of people did have relatives or friends or colleagues or church members or who they could say, well, this has happened to this person, and so this is most likely going to happen to me. And so I began to engage my patients in, changing their mindset.
Yes.
Like, how about if we look at how to control your blood sugar so that we can lessen the burden or the complications of diabetes? And then a few years later, I noticed that I was having patients really engaged and excited coming to see me in the office. And I just casually mentioned to a patient, I'm like, wow, I'm having patients, coming with Excel spreadsheets of their blood sugars. Like, I didn't even know how to do Excel.
Yeah.
I said, well, I'm kind of giving them the same information over and over again. And this was really designed for my patients in my private practice at the time. And I said, well, why don't I write a book? And she's like, why don't you? And I'm like, oops, I didn't really expect the challenge. And then I sat down at my kitchen table one day and just said, I want to make this a playful experience, not something that's really serious, like something that's easy to understand and get patients in action. And I just had this download of A to Z.
I love it. I think what you're doing is truly empowering people with their health. And so what are a couple of the most important messages that you share with people, maybe 2 or 3 that you can give to those living with type 2 diabetes?
Absolutely. So the book starts with A, B, C. A for acceptance. Accept that you have this diagnosis. Okay, a lot of people go into denial. So A starts with acceptance. B for belief. Believe that you can live with this. And then C, commit to change. Those are the first 3 things, and I call them my foundational principles. And without those, the rest is just history.
I was kind of peeking at your ABC because I knew that's the most important start to this book, and then you get into some real, nitty-gritty stuff. But the C, I love that you talk about the stages of change,
yes, the stages of change,
and really how to do that, and that you might change some behaviors and then have a relapse, but how to get yourself through that till you get to the point of making real and lasting change.
Absolutely.
Who is your ideal audience? Is it someone who is currently living with type 2, who just got diagnosed? If they have diabetes, who would you like to read this?
My ideal audience is anybody who has just been newly diagnosed with type 2 diabetes. And by the way, we also have a subset that's out there smoldering called the borderline diabetics, who may have just been told by the physician, well, you have borderline diabetes, go adjust your diet. So that's also a target population, in addition to anybody who has a family member who really wants to be a champion for somebody living with type 2 diabetes, and just for the general audience, get information about this and realize my premise really is that diabetic living is actually healthy living. And if we can change that mindset and get people to become engaged in not just what am I supposed to eat, what am I not supposed to eat, but look at diabetic living as a step to healthy living.
I think that's incredible. So I think that's a wonderful takeaway. I want to make sure everybody can get a hold of your book as well. So again, it's Dr. Enno's A to Z Guide to Thriving with Type 2 Diabetes. And again, it'll teach you how to thrive and realize that this is just a step towards healthy living. I think it's wonderful. Thank you so much for joining us.
Thank you so much for having me.
Yeah, you can find this and more on our website as well.